Welcome to Friends with Fertility, the podcast where we dive deep into the world of fertility, reproductive health, and all the emotional journeys that are in between. I'm your host, Elizabeth King, a fertility expert dedicated to providing you with the knowledge, support, and inspiration you need on your path to parenthood. Whether you're just starting out, exploring your options, or looking for solidarity and advice, we are here for you. Let's embark on this journey together and turn uncertainty into empowerment and make friends with fertility. Let's get started. Hi, everyone. Welcome back to Friends with Fertility. Today, we are talking with Dr. Leah Roberts. Welcome.
Hi, thank you so much for having me today.
Thanks for being here. She is a reproductive endocrinologist and fertility specialist who has had a unique experience of growing her own family through IVF and a gestational carrier. She loves to share both her professional perspective as well as being a fertility doctor, and loves to be able to help people to see something that would interest others based on her own experience. So welcome, and I cannot wait to have this conversation because throughout my own journey and everything that I've done in the last 9+ years in this space, I've always gone to, it's just another day in the office for the doctor and it's life-changing for us. And that doesn't always mix. And for the time that I've been kind of even one foot in this experience for the last 30 years, which sounds crazy to say, the doctors that have been here since then mainly have been male, quite honestly. And so I feel like we're now seeing a new set of younger doctors, women doctors as well, who do have a different perspective and maybe who have gone through it like yourself. So tell us a little bit about your story. And first of all, how did you go into reproductive endocrinology? Let's start there.
So my story is really interesting because I actually worked as a generalist for a year before I went into infertility care. I came up during the time of some of the worst COVID, and I worked as a generalist during, that 2020 year when everyone was really sick.
Yikes. Yeah.
And then I started my fellowship, and I just really wanted to be able to have the time to really sit down and make those connections with the women I was treating. And unfortunately, as a general OB-GYN, with a lot of the demands of the insurance companies and everything else going on, I was seeing 40 patients a day. I just wasn't really able to sit and delve in. And I was discovering that I was really enjoying most helping people figure out the puzzle of exactly what was going on with their hormones. And as much as I love delivering babies, COVID kind of beat that out of me a little bit. So I ended up in this infertility space. And, certainly before I had my own children, I cared deeply about my patients. I mean, I think there are a lot of us who are, up at 2:00 in the morning, staring at the ceiling, thinking about our difficult cases and wondering what's going on and how our patients are doing. So I definitely think that I was always a compassionate doctor. I always cared, but there's something that is just weighty about having an embryo in your hands and doing a transfer, knowing that this could be the difference between like my little Savannah at home for somebody. And I think just being a mother in general has changed that, but especially being someone who has had a child through IVF, it really puts a perspective into play. And also I can just be like, oh, this is the day that you're going to be really cranky based off your meds, because I've been on those same meds too. So that's definitely changed my perspective.
So from the time that you were a generalist in 2020 to when you talk about your Savannah, your daughter now, what was that time frame? And had you gone through your own fertility experience at that point? Like, were you aware, like, maybe I will have issues or not? And for those that are listening, and I'm just going to be a general statement, I don't know the stats on it. Maybe you do, Leah, but doctors have a very high rate of infertility for several reasons, but and I'm certainly not putting you in that category, but I think a lot of times people don't take that into consideration, whether they're going into the field of medicine, thinking about planning their family, or how might the stress of the job or whatever it may be play a role in that as well. But where were you on that journey when you decided to kind of pivot your specialty?
Absolutely. So, we say 1 in 6 women have infertility, or 1 in 6 couples have infertility. But for female physicians, it's closer to 1 in 4. And it's probably even lower for lower total number of women, like 1 in 2 or 1 in 3 for female surgeons,
Mm,
because we tend to delay childbearing a lot, but we also tend to have certain lifestyle factors like shift changing of work, day and night, all of
right.
these things, a very stressful work environment, exposure to all sorts of chemicals that also add to that, as well as the significant delayed childbearing, because I was still in
Right.
training in my 30s.
Right.
So my journey is a little bit different. I didn't have true infertility. I needed to use a gestational carrier because of the inability to safely carry a second pregnancy.
Okay.
So I, full disclosure for that,
Mm-hmm.
I was in my second year of fellowship when I had my son, and I was pretty much in the hospital the whole time. I did my thesis from a hospital bed, which was
Oh,
great because I
wow.
was able to do it on my computer, but I couldn't do any patient care, and I was very, very sick. And the high risk OB told me I couldn't carry another pregnancy. And so I basically immediately went to my attendings and was like, when can I do an egg retrieval? I want another child. I want to use a gestational carrier. And they were like, okay, slow your roll. Your body has to recover. And I did my retrievals like right as soon as they would let me, which was just about a year out from delivery. I actually did 2 egg retrievals because I did have my own challenges and I wanted to make sure that I had enough embryos for my full family, which is so important because I think a lot of times we're so focused on getting someone their first live birth, which is so important, but we don't think about like, okay, maybe they want a second or a third child. And by the time
Right.
they get to that second or third child, it may be that much harder to conceive. So I wanted to make sure that I had all the embryos I would need for maybe a third child, which I was able to do. And then, during the period of time that I started as a new attending, that was really the time that I was going through the process of finding a gestational carrier and doing the gestational carrier process. And my Savannah is 6 months now. So we're just
Mm.
newly second time parents.
That's exciting. Congratulations. So, okay, there's so many things I want to talk about with this because I think, again, people who have struggled with pregnancy, they think this is exactly what you're thinking. Maybe they haven't physically, literally been told it yet that carrying isn't for them, but they know it's hard in one way or the other. And maybe they have a diagnosis or they don't. And they want to do a gestational carrier. It's not so easy as to just like roll up to your fertility doctor and say, I want to have a surrogate, or your OB or whoever you may think it is. Walk people through the process, because I think there's a lot of misconceptions of like, I just don't want to get fat or I don't want to be pregnant. And so I want to have a surrogate. Unfortunately, it's not that. And I think a lot of people think that that is what you can do. So, can you kind of demystify
Absolutely.
the idea that you just don't want to get fat, but you want to have a baby, so you're going to have a surrogate, or you don't like the idea of giving birth or whatever? Please help
Absolutely.
people
So
to
this is
understand the
a
process.
question. This is a question I get all the time, and really, what it comes down to is the IVF is the IVF. That part is the same, making
Right.
embryos and moving embryos. But so many other things go into a gestational carrier journey. First of all, most agencies have a 12 to 18-month waiting list of having gestational carriers, because I think it's like only 1 in every 200 women are really eligible to be a gestational carrier once you figure out who would desire to be a gestational carrier and then who medically qualifies. So the pool is very, very limited. You have to do a whole bunch of blood work testing so that the FDA approves of the transfer, because they treat an embryo transfer like we would treat like a liver transplant or any solid organ transplant. You have to do a whole bunch of legal stuff. So, legal contracts about the gestational carrier journey, even if it's altruistic and you're not paying them anything for the journey, which is unusual but does happen, there are still a lot of logistical things that you need to make sure everybody's protected in. And then there's
I just
legal.
want to interrupt you real quick. So that's all of what she's mentioning is part of why it costs so much. It's not just like it's expensive because they want it to be. It's expensive because there's all these different layers of fees that come in from various aspects, like
Yeah, like I have
attorneys.
to pay my attorneys for their time.
Right.
We have to file legal paperwork, a pre-birth order with the state so that I have the correct parentage of my child. Essentially, I almost had to like adopt my own genetic child.
Right.
We had to do site clearance to make sure that we were psychologically well to do this, so that she was as well, that her family was going to be, safe and healthy through this. We had to do full investigations of her uterus, fallopian tubes, make sure she was good for a transfer. We had to get her insurance. That is a huge, huge portion of the journey because most insurances are not going to cover a gestational carrier journey. So we buy separate insurance for that. We put in special insurance for like an ectopic pregnancy if there are any kind of complications. Bed rest policy, because what happens if she can't work? She still has to support her family. And so it gets really complicated. There's
Mm-hmm.
psych, there's legal, there's insurance, there's making the embryos itself, even before you get to transfer. So the whole process, I did an independent journey. I didn't use an agency because I had a person that we knew privately who was willing to do it, and I could manage my journey. But most people need to use an agency, and I would start like a good 2 years before you're ready to actually have your baby in your arms.
Yeah, thank you for mentioning that again, because you have to meet certain criteria in order to qualify to have a surrogate as well. So again, and maybe that's different for if your sister says, no, I'll have a baby for you if you don't want to get fat. Is that a thing that you even then, or because of this psych
So it
test,
depends on the
you know
state
what I
you're in.
mean? Okay.
Most states have some kind of restriction.
Okay.
So, in the state of Florida where I'm at now, you have to have a medical reason for using a gestational carrier. You can't just be like,
Right.
oh, you want to get fat. Now, certainly if you have like severe anxiety after a postpartum hemorrhage, or, there's reasons that aren't necessarily like bread and butter, like, oh, you can't
Sure.
carry a pregnancy because your uterus doesn't work.
Right.
Um, but just because somebody doesn't want to carry is not usually how it happens. I know you see like a lot of celebrities using gestational carriers, and it may seem like they don't have a reason, but just from personal experience with some people who, they don't have to share their medical history with us. A lot of times they have had damage to their uterus for one reason or another, whether they've had surgeries on their uterus, they have fibroids, they have a thin lining, they have other issues. It may seem like they don't have a reason for using a gestational carrier, but almost all of them who have had a medical reason to do it. They're not just doing it for kicks and giggles, especially
Right.
those who had multiple pregnancies first, like Kim Kardashian with her
Right.
accretas. That's it's not that she didn't want to get fat. It's just
Legit.
yeah.
Yeah. And I just want to point that out because people ask me it all the time and think that there's this new wave of surrogacy because of the celebrities and, oh, they have the money, they can do it. But they all have a reason behind it. And it's not just because they don't want to. And I think that there's this big misconception, which divides a lot of people politically and religiously and all kinds of things because they're misinformed about how it is that you can even go ahead and do that. So thank you for clearing that up because there's a lot of noise out there, I feel like,
Of
around
course.
surrogacy and gestational carriers. And
I think
even the term gestational carriers, there are many ways and many different types of surrogacy, even within that, that people can do. So I think from that perspective, also just being educated more about it if it's something that you're curious on.
I think there's just so much misinformation with like the celebrity culture in general. Like people see, oh, somebody got pregnant at 50. Well, 99% of the time they froze their eggs when they were younger, or they're
Right.
using donor eggs. So
Right.
and they don't have to share their story. I'm not saying that they should have to share their story, but there's so much kind of disingenuous information out there of
For
people
sure.
who, have various ways that they've completed their families. When
For
it
sure.
comes to terminology, the appropriate terminology when you're using your own eggs or a donor egg that is not being carried by that same person is gestational carrier. Surrogacy is kind of a catch-all term. Traditional surrogacy uses their own eggs, so they carry a pregnancy that's genetically related to them, but in reality, it's really used often very interchangeably.
Right. So there's a lot of sites now that offer like the glossary of terms if you're trying to go down this route to learn the ins and outs. I would suggest even way before, like Dr. Roberts was saying, start your journey of just educating yourself on all the different ways and reasons it's so expensive and everything. Because even if you get to a point where this is what you're going to do, it's not a for sure thing. And I hate to say that, but I've seen it time and time again where people are like, okay, we finally made this decision that we're going to do IVF, and or not only are we going to do IVF, but we're going to have somebody else carry so that we really get our baby. And sometimes it doesn't quite work out that way. So once you decided, you said you did 2 rounds of IVF. And how did that go for you? You said you felt a little.
So I think the most difficult part, I had heard patient complaints over the years about shots and different things, and I get vasovagal. When you give me a
Hmm.
shot, I will throw up, I will faint. So I was expecting that to be the difficult part because I'm an awful patient. And really, the part that I found to be the most difficult was the lack of control. I'm A type, I'm a
Mm-hmm.
physician.
Right.
You tell me to do A, B, and C, and I will do A, B, and C exactly perfect. And there was a loss of control. I couldn't control what my body was doing. It had already kind of failed me with the pregnancy where it tried to kill me. And, I couldn't predict how many eggs I was going to get. I couldn't predict when I was going to go for retrieval. I didn't have any control over what was happening. And that lack of control and uncertainty was really, truly the hardest part, the psychological portion.
I think, again, most people don't recognize how heavy that is, right? If like you think, okay, I might, again, I hate to use this example, but get fat from the hormones. I hear that people say that a lot. When I went through IVF, I didn't gain any weight, so everybody's different. I always say people that are afraid of needles realize, oh, it's actually not that bad. Or maybe they weren't afraid of needles and they become weirded out about it because it's so much. Whatever it may be, everyone is different. So I always say that to people. But also just the expectation of feeling like I've got this and I can do it on my own, because again, most people that I talk to are type A. And so they're like, it's no problem. Like, we're just going to get through it and be done with it. But I think like also the amount of waiting and testing and like the anticipation of information and what that means to your journey isn't fully explained with the emotional charge behind it, right? So you can be given information like, okay, Leah, this is how it's going to go down, and this is what we're going to do, and every other day we're going to measure this or that, but you don't realize like what that does to your soul when your
And
eggs are being measured, your
I,
follicles are being measured, and everything.
I'm trained as an embryologist. Like I've done all this stuff. I've done ICSI. I've done the egg fight. Like I know
Wow.
innately with my hands exactly every step of the process. I've run the PGT test. Like I've done all of it, and it doesn't make it any easier
So,
at
what do
all.
you suggest for people who are going through it? Because I get asked all the time, because
Therapy.
where I'm on the side of it, of that, I'm on the therapy side, and they're like, oh, does it really work? Do I really need a coach? Do I really need somebody to work through this with me? Like, I think I can do this. And by the time they get to me, they usually can't even like take a breath because they're crying so much because they've had so many failed rounds or losses or whatever it is. And if I could only tell people, just have somebody help you from the get-go, right? And you may or may not be surprised of how easy it is, or how much easier maybe it could be for you if you have somebody walking that process with you. Why do you think that is, that we try to again be like, no, I got this. Like, it's cool. I'm cool. We're okay. Let me just get through it and power through it. And, it's only X amount of weeks through the shots and then we'll be fine. Like, what do you think that is, that, as I won't just say women, because, my husband was along for the ride too, and he's kind of supporting whatever it is that I wanted to do. But like, why can't we just be like, okay, I'm signing up for the gym and a trainer because I want to lose weight. And so this is what I do in order to get to there. I'm signing up with an RE and a mental health person to help me through this so that I can get X. Why do you think people are so hesitant about really leaning into the fact that the mental health goes together with the process of IVF and or just fertility in general, quite honestly? I mean, I remember trying naturally and being so disappointed every month when I would get my period.
So I'm from a family that very much believes in therapy. My sister is a professor of psych at Clemson. So I come from maybe like a little bit of a different background from other people, but I think people don't realize that the emotional toll and the anxiety that comes with an infertility diagnosis in research has been shown to be as hard as a cancer diagnosis. Like
Right.
this is not easy stuff. And we're like, oh, well, women have been doing this for thousands of years. Women can just get pregnant and whatever. And so they just don't realize, and they want to be strong and independent and not have to lean on anyone. And it feels like your body's betraying you. So you don't really want to admit that to somebody else. So I think it's really hard for people to lean into the help. And whether it's your village or a therapist, I kind of feel like everyone who gets a new patient visit with me should get a new patient visit with a therapist at the same time, because it's just so important. And then, let's say they do get pregnant, navigating pregnancy and pregnancy hormones and, pregnancy OCD and all sorts of the stress of pregnancy. And then you have a newborn and navigating the relationship with your partner. And, I feel like every life stage needs therapy
For
personally.
sure.
But
Yeah.
um, I think infertility is also not always understood by every single therapist. I think it's so important that you meet with somebody who can meet you where you're at and understands the process. So I wouldn't just say, like, oh, just go to anybody. You really want to go to somebody who's trained in infertility. I think ASRM is doing a pretty good job of trying to do more and more training and more focus and research into the field. But I think it's been, like most women's health, just a very ignored area of mental health for a long time.
And something that was not traditionally, therapists are trained not to share their story, right? Of like,
Exactly.
you keep this boundary, doctors as well, for the most part. But I think this is such a unique experience of fertility that having somebody knowing that they went through it and they're on the other side of it, or they get, maybe their story isn't exactly like yours, but that they understand the nuances to it, really makes such a difference. And I recognize that in my own journey after my first loss, where I sought out somebody who specialized in miscarriage loss, recommended by the hospital. And I walked out of there more upset than I was starting, because I didn't know if she had ever had a miscarriage. I didn't know if she had children at this point. I just wanted someone to give me hope and to say, I feel you. I know this is so hard, but you will get through it and we'll just figure it out together, one step at a time. And that wasn't what I got. And I think nowadays people are doing that and people are sharing and more open about their story. And I think that really goes a long way, which then leads me to, are your patients knowing your journey just by searching you out and knowing what's going on? Or are you, when someone's on the table, do you say oh, by the way, I've also gone through this, so I know what this feels like? Like, how has that now changed your perspective from being a physician and now an RE, helping people through the exact process that you went through? Like, what is
I
that
mean, I'm an
dialogue like?
open
Does it
book.
change now?
I'm an open book, and so a lot of my patients do know. I have
Yeah,
my story on my Instagram, so anyone who's looked at me there, it's like freely available. Do I
right.
bring it up at like new patient consults? It depends. Certainly, if someone needs to use a gestational carrier, I always mention, like, full disclosure, I use a gestational carrier. I've been here. I know.
Yes,
A lot of times at a follow up visit, when people are like, "How am I going to feel?" I'll be like, "Well, on this day, you'll feel like this from personal experience," like that kind of thing. But I'm sure that there are some patients who are not completely aware of my journey. I know that when people are having a hard time, some of the other physicians will pull me in to be like, hey, like, can you talk to her about your experience? And I'm happy to do that. And I think there's almost like we call them fertility veterans, but people who have been successful through their fertility journey, like a fertility buddy. They're not a mental health professional, but having
absolutely.
someone who's like lived through it can be super helpful.
For
I
sure.
obviously can't be everyone's fertility veteran for my own patients, but
Sure.
certainly I talk a lot to like other physician women who are using gestational carriers. And I think finding, there's a couple different networks. I know JFF has like a fertility buddies system, and we like try to help connect people who are willing to talk about their experience, because that, even just a support system of someone who's like been through it from a non-mental health, non-scientific perspective, can be super helpful.
For sure. And I think too, just knowing that somebody in the vicinity of where you're at getting your care knows what you've been through makes such a difference. Because as much as I still love everyone that was in the clinics that I went to, they weren't qualified or prepared to be dealing with somebody who was struggling emotionally through the process. They're trained in, either embryology or the RE or the phlebotomist or where, the front desk, whatever their role was, that's what they were an expert at. They were not an expert at trying to comfort me. And it's not that I had that expectation of them, but I remember then Resolve was the only option out there when I was going through it. And not everybody wants to talk about their situation in a group setting. And I told you my experience with the therapist. And I remember thinking, like, I am spending so much time and energy and money in this clinic. And I'm walking out of here every single morning at 7 a.m. feeling so down of like, what am I going to do about my life and my family? Like, and again, not that it was their job, but I can imagine working with you and knowing like she gets it, even if we're not having the conversation, knowing in the back of your mind, like, I know that she's on the same wavelength. Like she knows what's happening with my mind when I walk outside the door, right? As opposed to like, okay, I'm going to try to focus on my job today. I'm going to try to focus on life. And this was even before I had kids. So then when you add kids on that, right, you're trying to get pregnant and you have a toddler and you're not sleeping, and that's a whole nother mess and conversation to have. But it's just, I think it's so beautiful that you're sharing your story, because I think you probably underestimate the gravity that it has for people that are working with you or hearing you to say, like, I want to work with her because I want somebody who gets the experience of the whole process. And I think that's so awesome to now have a platform too, to say, I get it, I've been there, and I know how you feel.
I mean, I think that male REIs can do an excellent job, but I think more and more young women are coming into this field, and I think it's really, really helpful. I know that I personally like my female younger gynecologist. She's amazing, and I think I can relate a little more. Certainly there are people who want like a very paternalistic doctor who's just going to tell them what to do rather than something more collaborative, and they might not be a good fit for me. But for me, I find I have these really beautiful relationships with my patients where like they're inviting me to their baby showers and I get to see these kids, and I'll be in Publix or I'll be at the daycare and I'll see someone. I went to a birthday party and I was holding 3 babies that I helped make, and there's just nothing
That's
like
so
that.
cool. Yeah,
So
that's awesome. And again, for the men out there, the doctors that I have had, even too, we love them and we appreciate them, but it's also very different. And if the men had been through it too and said, my wife went through this, or I went through this, or whatever, I feel like that goes a really long way. And people just don't realize what it's like to lay on that table, and building a family is so different. And yes, that Mayo study that talks about the cancer comparability to fertility, it's just, people don't get it. People don't understand how big of a deal it is when you go through it. And even the word cancer is talked about, or you have this awareness as a child of like people have it or somebody was diagnosed with it, but you don't have the awareness of infertility and that somebody has gone through this, or IVF. I think now with our generation having more open conversations with children and knowing how they were brought to the world is great for our little ones growing up, but that's not how the world operated before. And so I think that really goes a long way for everybody to just be more at ease and normalize the conversation so that everyone feels better, just
I mean,
mentally,
whether
like it
you're
just
talking about
rises.
menopause, miscarriage, infertility, I think we're really opening up about it in a way that a
Right.
generation ago nobody talked about menopause. Nobody talked
Right.
about these things. And I mean, I haven't really talked to my son about menopause yet necessarily, but like we have a book, The Very Kind Koala, and we talk about how his sister was grown in our gestational carrier's pouch. And he talks about, oh, she's got a baby in her pouch. And, he has the vocabulary at 3 to talk about, infertility in a way that like, we didn't even talk about sex growing up. So
Right. Yes. When you started to do the fertility work rather than the generalist rotation and all that, did you feel that you were given enough training or background had you not been going through it yourself? Like, did you see that gap of, um, what's the word? Not education per se, but like at ASRM, for example, I went to one of the um, presentations on loss, and they asked one of the doctors, were you ever taught anything in school about anything about how to talk to a patient about their mental health and any of this? And she was like, no. And so now that, I mean, you're much younger than a lot of the doctors that were there. Are they talking about it now? Do they talk about how to doctor a patient from a bedside manner type of mental state? Or is it
Well,
still
I
just
was
because you
really
have that background with your family and it's like natural for you to be that way, you
I
know?
was really lucky in a lot of ways. My residency program did a really good job at that. I
Oh,
think,
good.
I was at Temple in North Philadelphia, Go Owls. And
Yeah,
I think that we did a lot of stuff about like delivering bad news and talking about
that's
situations.
like,
And part of it was like being in North Philly, I dealt with people with gunshot wounds through the uterus. And like I had to tell people that, they lost their baby and, their leg and different things like that. So I think my program did a really good job about talking about loss and miscarriage and stillbirth and that kind of stuff. And then in fellowship, I was at RMA New Jersey, and we have a whole mental health team. I don't think that most fellowship programs have a mental health team, but Jen Gamper and her team, like, we sat in on social work consults. We sat in on psych consults when we had miscarriages, when we diagnosed issues. We had social work on the phone immediately, and they would come in and we would do a whole session together. So I got a lot of training in that in fellowship, but not all fellowship programs
right,
have psych embedded in the program. We did 10,000 cycles a year. We were a huge, huge, huge program. So I felt like I got pretty good training on that. Now, it's never easy. I'm never going to do an ultrasound and not see a heartbeat and not want to cry and run away. Like, that's never a fun conversation to have. But I think that the more you do it with support in something like fellowship, the more comfortable you are and the better you can make that experience for patients. The worst thing is to be like, well, you got this far, you got further than you got before, blah, blah, blah. Like, that's not helpful. But I think that's our natural inclination, is to be like falsely cheerful.
right,
So I think that I was lucky in that I had experience with that. I can't speak for the rest of the REIs in the
right.
country, but certainly that was something that has been started to be focused on a little more, I think.
Yeah, and RMA New Jersey in particular has people on their team that have that as a background and they're unique in that way, I will say. And I think maybe now that more private equity, it sounds horrible to say, that owns a lot of these clinics, will bring in the mental health rather than just the psych evaluation. That's like a standard thing, to recognize that that also helps their bottom line success rates as well. So what advice do you give somebody who's kind of starting on this journey, doesn't know where to go, and or maybe they're thinking that they do need a gestational carrier and want to go figure that out? What
So I
can you
think the
say to
biggest thing
them?
is to just give yourself grace. Like, it's okay to struggle. It's okay for it to be hard. No matter how beautiful or wonderful your journey is. Like, I had the best gestational carrier in the entire world. She is amazing. She's like an aunt to my kids. We talk every day still. It sucked that I couldn't be pregnant. It sucked that I didn't feel those kicks and that the maternity photos have both of us in it, but she's the one that's pregnant. Like, there is nothing that is going to make the fact that I did not carry that pregnancy not suck. And it's okay. It's sort of like when people have like gender disappointment. Like, I didn't. I'm lucky. I have a boy, I have a girl. I didn't care what I had. But, people feel so guilty. Like, oh, I have a boy. I really wanted a girl, or something like that. You just have to let yourself sit in it. Like, it's okay to be mad that you have infertility. It's okay to be mad that your body isn't doing what you expect it to do, that you've been trying for 9 months and not getting pregnant. Yeah, I don't care that people say try for a year. Like, it's okay that it sucks. I think stay off of the internet. I think
Love
Facebook can be
it.
our best friend and our worst enemy. But if you're diminished ovarian reserve and you're comparing yourself to someone with PCOS, you're going to be disappointed. Bring someone with you to your appointments, whether that's your partner, whether that's your best friend, your mom, doesn't matter. You want another set of ears to hear the things that you don't necessarily hear, to all your appointments. A lot of times that can be your partner, but if your partner can't come to any appointment, bring a support person to kind of get another set of ears on everything,
It's
so
great
that when
advice.
you don't remember, you'll have somebody else who's listened. Um, and lean into your support network. I think, yes, it's sort of like with pregnancy. You don't want to tell people that you're pregnant at 6 weeks if you aren't willing to have a conversation with them about having a miscarriage, right? Like, that's, people say don't share until 12 weeks, and I always say share with anybody that you'd be comfortable sharing the good and the bad with. And I
Right.
think that's the same thing with infertility. Don't share with your nosy aunt who's going to ask every day, are you pregnant yet? share with your best friend who will be there for you and will help you and will order you cupcakes on the day of your retrieval, which is what I got.
Yeah, that's fun. Well, I think that is all really great advice. And again, coming from you that has been through every angle of it, quite literally, which is, I think, so valuable to have in your corner. So where could people find you, learn from you, work with you?
So I'm in Boca Raton, Florida. I'm at a practice called Boca Fertility. We've been around since 1982. Myself and my partner, Dr. Margolis, joined the founding partner, Dr. Perez, about 3 years ago. We have an office in Boca and in Fort Lauderdale. So depending on where you live, we hopefully have one nearby you. But of course, we do telehealth. I see patients from all over the world that kind of just fly in for retrieval and transfers. And we're hoping to expand to some other locations in Florida soon, but that's hopefully coming soon.
Amazing. Well, thank you so much for your time today and sharing your story and just bringing your heart to the experience of people who are trying to build their family in such a beautiful way.
Absolutely. And if you have any questions, you can find me on Instagram, Dr. Roberts Fertility, and then you can email me or whatever. And thank you so much for including me today.
Wonderful. Thanks for all that information, and look out for Dr. Leah Roberts. Thank you for joining us on this episode of Friends with Fertility. We hope that you found the stories, insights, and tips as inspiring and informative as we did. Remember, you are not alone on this journey. Your Friends with Fertility are here for you. If you've enjoyed today's episode, please subscribe, rate, and leave a review on your favorite podcast platform. And don't forget to follow us on social media for updates and more fertility resources. Until next time, stay hopeful and keep believing in your journey, and know that we are sending you lots of love.